Good evening. I'm Selwyn Collins, your host of CWS Conversations with Selwyn. Thank you for joining us this evening. And to those of you who are joining us for the first time, a special thank you. Tonight is extremely special to me because our guest tonight is an old friend of mine from high school, actually. And in spite of his very busy schedule, he took the time out to spend some time with us this evening and to share his journey with us. And for that, I'm eternally grateful. Cargill Alleyne Jr. graduated cum laude from Yale School of Medicine in 1991 and completed his neurosurgery residency at Emory University in Atlanta, Georgia. He completed a fellowship in cerebrovascular and skull-based tumors at the Barrow Neurological Clinic in Phoenix, Arizona. He practiced at the University of Rochester, New York for 4.5 years before being recruited to Augusta, Georgia, where he's now professor and the Marshall Allen Distinguished Chairman of the Neurosurgery Department. I hope my audience is hearing me. Hold on a second. Sorry about that interruption. I may proceed. He's a member of numerous professional societies, including the Society of Neurological Surgeons, Congress of Neurological Surgeons, American Association of Neurological Surgeons, and the Georgia Neurosurgical Society, GNS. He is past president of the GNS and past president of the Neurology, Neurosurgery section of the National Medical Association. He has written extensively in his field as of May 2013. His bibliography includes 199 scholarly contributions, including manuscripts, abstracts, posters, chapters, and books, and 113 invited lectures and visiting professorships. He has recently completed Ned's Head, his first children's book. He's working on more in the series, including Bart's Heart, Nellie's Belly, Jones' Bones, Malachi's Eye, and Russell's Muscles. Dr. Alleyne enjoys the movies and spending time with his wife Audrey, an anesthesiologist, and his two children, Nathan and Nicole, who inspired him to write Ned's Head. Please, I ask you, my audience, to ignore that song, that phone that is ringing in the background. I apologize for that. But after the break, I'll introduce you to Dr. Alleyne. I am back. I am Selwyn Collins. For those of you who are now joining us, the host of CWS Conversations with Selwyn, the distinguished gentleman, I should say, on the side of me is Dr. Cargill Alleyne Jr. Dr. Alleyne, good evening.
Good evening, Selwyn.
How are you today, sir?
I'm doing just fine. Doing just fine.
Thank you, first of all, for taking time off of your busy schedule to join us. I really appreciate that.
You're welcome.
I want to start by first thanking a mutual friend of ours, Jonathan Locke. I know I played an ugly trick on Jonathan when he returned from the Bishop's reunion a few years ago. He was so full of excitement, and one of the things he said, Selwyn, you should have been there. Cargill was there, and you got to get him on your show sometime. And I said, yes, I have it in the works. He says, no, but you got to get him on the show. I said, yes, John, I have it in the works. So when I started, discussing this possibility with you, one of the things I wanted to keep close to my chest is when you're going to come on the show, not letting Jonathan know until the time is right. So I have to thank him for his enthusiasm and pushing me in this direction. But not only Jonathan, there are many of us who have gone to school with you who are very proud to have you here this evening. And it's evidenced by the overflow of likes and indication that they will be tuning in tonight to listen to you. I have quite a lot of questions. Your career is packed. You've had a very extensive journey, so I want to get right into it.
Okay.
So, Dr. Cargill Alleyne, congratulations on all your accomplishments in and out of the medical field.
Thank you.
You're welcome. It is an honor, both as a high school friend and a host, to converse with you this evening. What prompted you to want a career in medicine, and what made you decide to go into neurosurgery and not any other specialty?
Well, it was a gradual discovery, I think. When I came up from Guyana, I went to college at George Washington, and my initial hope was to do chemistry. In fact, I was a chemistry and math major in college. And one day in the chemistry lab, I had an epiphany because there were about 4 of us left over, kind of studying hard for some exam that was coming up. And I realized, although I liked chemistry, I didn't want to be stuck in a lab tinkering with test tubes for the rest of my life. To some extent, it seemed very impersonal. So that's the point at which I started thinking about other possible fields. And medicine was one thing that came to mind because I realized that there were a lot of different subspecialty areas in medicine. So there's literally a specialty for every penchant or every ability and personality. So that's when I first started looking into medicine and decided to go for it.
Okay. You were born in Guyana, South America, to an economist and a school teacher. Give us a glimpse into that world. First, as a 10-year-old, and then as an adolescent.
Well, I grew up in a small family. My parents and I have one sister, Carl, and she's actually also a physician. She's a pediatric psychiatrist. But I just have idyllic memories of home, kind of growing up with friends. And, I always tell my kids that, I didn't grow up with television. We used to read and play outside. So always admonishing my 13-year-old son to get off his little, handheld devices and read a book or go outside and play. But I think at that age, I think we were very fortunate to have parents who valued education. Mm-hmm. And my mom was a high school teacher. She eventually became head teacher at Bishop's where I went to high school after I left. But she instilled in us the importance of education, and my dad instilled in us the importance of hard work. So I think the combination of having a teacher in the family and an economist who was always hardworking helped to lay the groundwork for our future, for both my sister and I.
And saying that, do you recall any special words of wisdom that you received from your parents that have shaped who you are today?
Yeah, actually, back home, back in those days, I think it's still the case today, but we take a set of exams, first a common entrance to get into high school. And then, as a former British colony, we took the GCE O-level exams and the A-levels. But I remember studying for the O-levels. And at that time, we were good students, but my goal was just to kind of study and do as well as I could. But I remember my mom whispering in my ear one day, she said, no one's ever gotten 9 distinctions in O-levels. At that time, it was a combination of O-level and CXC. Mm-hmm. And I think, in her way, she actually planted the seed of that goal in my mind, without, beating me over the head or saying this is what you need to do, very subtly just kind of planting that goal in my mind. And so, I actually began studying with that goal in mind. And I think that was the first lessons that unless kids at a young age are actually given some direction or given a goal, very often they'll never achieve their full potential. And so, I firmly believe if my mom didn't actually mention that to me as a possibility, I probably wouldn't have studied with that intent. And as luck would have it, I actually did get, I was the first person in Guyana, the first student to get 9 distinctions at O-level and CXC. And so I always remember that. And I tell, when I lecture to the kids in the primary school or high school over here, elementary schools, I always tell them to reach for the stars. And unless someone actually, tells them or guides them, they may never have that intent, and so they may fall short of their goal.
Well, can you still hear me?
Yeah, I can hear you.
Well, congratulations on the 9 distinctions. I see the kids today are doing 20 subjects and
that's right.
19 subjects and all these things. I don't know what we would have done back in those days, but I guess we probably would have.
In a few years, that record was broken, so I helped for a few years. But,
so, what is your favorite memory of your parents while you were growing up in Guyana?
I think just the fact that they gave so much love when we were at home. You hear stories about such dysfunctional families, and maybe I just got lucky, but we were a relatively small family. We had a big extended family, but I think we were always showered with love. Always encouraged to do the best we can, both in classwork and outside of class. I mean, we, participated in sports, in high school, and we were lucky enough to be given the opportunity to do music. So they started out on the violin in the high school orchestra, graduated to the viola, played the piano. And I think that just helped enrich our lives at an early age. And to this day, I just kind of appreciate the musical education that we got at a young age with people like Mr. Bumbury at Bishop's and Miss Bowen.
Yes.
So those are old names from those old BHS students. I'm sure they'll bring some memories to mind. But I always have an appreciation of music, and even when I got to college, I kind of made sure that I took a music course every semester just to keep that interest going.
Oh wow, that's remarkable. My memory of Mr. Bunbury is hurting my chin with the violin. I think I took 2 classes and like a punk, I quit. But
That's
anyway,
right.
what challenges did you have prior and during medical school?
I'm sorry, say again?
What challenges did you have prior and during medical school?
So yeah, I mean, I guess the first challenge actually was one that I didn't recognize as such. But in college, I had a very good mentor. He was actually a chemistry teacher, and he was my advisor. And at the time, I was a foreign student on an F1 visa, and I went to him with the thought of doing medicine. And he sat down with me and said, Cargill, I think that's a noble goal, but you need to realize that less than 1% of foreign students actually get into a U.S. medical school. And that was the second lesson for me, because if I had taken him to heart, I probably would, just looked at something else, never done medicine. But, I think I realized that even though the stats may be true, you've got to do what you need to do as an individual. So in some respects, it made me, even more committed to medicine and to beat the odds. So as I tell kids, you may have very well-meaning mentors that will give you facts and stats, and if you're not careful, you can get terribly discouraged by what you're hearing. So you've got to have an inner resolve and just have those goals set for you, and just go after it. So, I was lucky enough to do very well in college with a double major, and applied to medical school. And that was the second challenge. The second challenge was when I realized that there were very few medical schools that actually accepted foreign students. In fact, when I looked around at the various med schools in the country, it turned out that of the schools that accepted medical students, there were even fewer that offered financial aid. And back in those days, and even to this day, medical education is very, very expensive and getting more expensive every day. So when it came down to it, I had basically, I had an acceptance to Howard. I was accepted to Johns Hopkins, again, a very good medical school, but they actually told me that since they had no financial aid for me, I would have to come up with $110,000 in escrow to pay for all 4 years' tuition, which was effectively saying, thanks, but no thanks. So I was lucky that I also was accepted at Yale, and they actually had a scholarship, actually a loan, a 12% loan. Sounds pretty high, it was. But so they welcomed me, and I was able to go through medical school with a loan, which took me, of course, 10 years to pay back. But I was very grateful for that opportunity to get an outstanding medical education here in the States.
Well, many of us are glad that you did persevere and you did find a way. As I say, it's not about having resources all the time. It's about being resourceful. So we are glad that you did. What is it about neurosurgery that appeals to you?
Neurosurgery is an interesting field. I think that when I was going through medical school, and by the way, I should comment on the fact that I was helped tremendously, not just by my parents, sending a small piece every now and then from Guyana, but also from a lot of relatives that we had living in the States. So, without them, I think my experience would have been a lot more challenging. But once I got into medical school, I was literally excited by almost every specialty. I mean, I could see myself doing several different subspecialty areas. But the key was during the third year, you actually start on the clinical rotations, where you actually go into the hospital, meet patients, examine patients, come up with a diagnosis. And my first rotation...
Cargill.
Yes.
Hold on a second. Let's take a quick break. For some reason, the camera keeps shifting, and I just want to make sure that I have it right.
Sure.
Okay?
No problem.
So let's take a quick break.
Arrowhead, I love my golden arrowhead. I don't think you heard me. I said arrowhead.
Okay.
All right. Go ahead.
So, yeah, my decision to do neurosurgery, again, was a gradual evolution. But on the wards as a third-year medical student, my first rotation was actually internal medicine. And again, I love the specialty. It was exciting trying to come up with a diagnosis for a patient. It was almost like playing detective. But the fact is that you end up doing a lot of talking and discussing in rounds and kind of walking from room to room. And even though at the time I was very involved in that subspecialty and thought I loved it, I realized that, at the end of the day, you're mentally exhausted from it. The very next rotation was actually general surgery. So there was a stark contrast between the two specialties. With general surgery, someone comes in with an acute or subacute problem, you make the diagnosis, and then you actually fix the problem. So you take them to the operating room or you perform a diagnostic study. And so you can see the full circle of a patient coming to you, making the diagnosis, doing the treatment, and having that gratification of seeing them go out to the hospital cured or treated. And even though we were in the operating room till 9 or 10 o'clock at night as students, I was going back to the dorm feeling refreshed. So that was the point when I realized that I was going to be some type of surgeon as opposed to be some type of medical doctor. And I think for most people, that decision comes pretty early in medical school. And then also, I've always liked anatomy and especially neuroanatomy. I think just, the fact that you have this intricate network of nerves, just kind of all making up the essence of a person is pretty incredible. And so at one point, I actually thought about doing neurology. But again, neurology is more of a medical specialty. Although you do some treatments, it's not as treatment intensive as surgery. So for me, the perfect marriage of general surgery and neurology was neurosurgery. And in fact, that was confirmed by my rotation on the neurosurgery service, where you saw just a great variety of diseases, some of them pretty bad diseases, but there was a chance to actually intervene and to change people's lives for the better.
What are some of your challenges in neurosurgery?
I'm sorry, say again?
What are some of your challenges in neurosurgery?
So neurosurgery is, again, a very, very intense specialty. So you see a lot of very significant diseases. One of the first challenges any training neurosurgeon has to deal with is the fact that you can't cure everyone. And there's some people with some very severe brain disorders or spine disorders. So, for instance, trauma, the hardest thing is going to a family and telling them that, their young kid is never going to walk again or never going to come out of the coma because of some devastating brain injury. Similarly, it's hard going to a family and saying, your loved one has a brain tumor, malignant brain tumor. We can treat it. We can do a subtotal resection, maybe a partial surgery. We can do radiation, maybe chemo. But the statistics say that, there's not a cure for this type of tumor. And so this patient will end up dying. I mean, that's hard to do, and it never gets easy. So that's one of the challenges. But, the flip side is that that's an opportunity for improvement. In fact, that's one of the reasons why I went into academic medicine, why I'm at the academic medical center, where we have the chance to actually investigate some of these problems in the lab or in a clinical trial to try to improve the status of patients with neurological disorders overall. So my subspecialty interest is in skull-based tumors and vascular neurosurgery, which is basically diseases dealing with the blood vessels of the brain. So things like ruptured aneurysms, which are tiny bubbles in the blood vessel in the brain that can burst all of a sudden without any warning, leaving patients either severely disabled or even dead. Or things like carotid stenosis, which is a narrowing in the carotid artery in the neck, which can cause bits of plaque to go downstream and lodge in a vessel and cause a stroke. Or another common vascular problem is patients that are born with a tangled mass of vessels in the head, called an AVM, or arteriovenous malformation. those can sometimes rupture and cause a problem as well. So, those are some of the clinical challenges that we deal with in my specific subspecialty area.
Do you think, in your opinion, there are enough or many um, minorities in neurosurgery?
No, we're definitely underrepresented in the field. To some extent, neurology too, but there are a lot more neurologists than neurosurgeons, and certainly with respect to the number of neurosurgeons in the black neurosurgeons in the field, relatively few. I just came off of a year of leading the neurology neurosurgery section of the National Medical Association, which is the association of all the black physicians in the country. And the neurology and neurosurgery group is relatively small, but it was a proud moment for me to introduce as our honored guest. We have a meeting once a year, and we generally try to get someone prominent. So I had the opportunity to introduce the first black female neurosurgeon in the U.S. as the honored guest. And by way of history, the very first black neurosurgeons were actually trained in Canada. They came through Canada and then came to the U.S. And so 3 of the first 4 black neurosurgeons were actually trained at Montreal Neurological Institute. And obviously, a lot of them went on to operate and practice at Howard. So certainly, Howard University has a big part in the history of black neurosurgeons. But I think to give you an example, I'm one of only 2 black chairs of departments. So there are about 100 training programs, neurosurgical training programs in the country. And for those of you who aren't familiar with that, the training program is the way by which we train future neurosurgeons. So, when you finish medical school, if you want to become a neurosurgeon, you have to get into a residency program at one of these training programs. And at the present, there are only 2 of us, myself and a physician called Keith Black. He's head of Cedars-Sinai Medical Center. Now, there have been previous black chairs in the past, but again, they've been few and far in between. And I think part of that is just not having a lot of role models. And I think that to some extent, I think we need to get out and just show the black youth that there's something else to aspire to other than football or sports or entertainment. And I think it will change. It's starting to change. Mm-hmm. Another mentor in the field is Ben Carson. He has been very vocal. He's written a few books and always going out on a speaking circuit to encourage kids to think about neurosurgery from an early age. And I've started doing that in my local community, going to the elementary kids and talking to them about the brain, just to kind of get them excited about neurology or neurosurgery at an early age. But I think we can certainly do more to encourage kids to do some of the more intense specialties. I think there's a tendency for a lot of the minority youth to go into internal medicine or family medicine, and that's good. I mean, we certainly need family medicine docs because we are, again, overrepresented in some of the very common disorders. If you look specifically at stroke, black patients are at a higher risk for stroke, mainly because they're at a higher risk for high blood pressure, diabetes, high cholesterol, and so all those risk factors combine to make stroke a big problem in the black community.
My next question was going to be any advice for young students aspiring to enter this field of medicine, but your answer just now was so eloquent and spoke so well in that to that regard. So I'll move on. What are the common types of problems you see in your field?
That I see where?
What are the common types of problems do you see in your field?
In my field, yeah. So, probably uh, as a neurosurgeon, we see back problems very commonly. So, ruptured discs in the back or the neck causing neck or back pain with arm or leg pain. That's extremely common, becoming more common as the population ages. So, degenerative spine disease is a big part of what we do. Even if we're subspecialists, so even if, for instance, I have an interest in vascular neurosurgery, I still see more spine patients because that's just very, very common in the population.
Mm-hmm.
Another popular problem or a common problem that we see are tumors. And tumors can be, categorized very broadly into benign tumors or malignant tumors. I see a little bit of both. And some tumors occur near the base of the skull where it can envelop the more critical structures like blood vessels and nerves. Those are called skull-based tumors. And so it requires a special type of surgery sometimes. You have to remove a little more bone to get at the tumors to get them surgically removed. Some tumors can't be completely resected or removed. And so we have more modern tools that we use to help with treatment, one of which is something called a gamma knife. So a gamma knife is a form of focused beam radiation whereby the patient can come in the morning in a procedure. They have a metal frame that's attached to the head, and we give them a very high dose of radiation to a very small area. And what that does is actually to stunt or even kill the tumor cells while minimizing damage to the surrounding brain around the tumor. And that can actually be a primary mode of treatment or something that's used as an adjunct to surgery. So for instance, you can take a tumor out, but if there's an important area that has tumor stuck to it, rather than risk injury to the patient, you can leave that tiny bit of tumor and then treat it with a gamma knife after the fact.
Wow.
So other than spine and tumors, vascular problems, as I mentioned, so ruptured aneurysms, AVMs or arteriovenous malformations, which are a tangled mass of blood vessels, carotid stenosis or narrowing in the neck, which can cause stroke. As a group, we also see patients with certain what we call degenerative or functional diseases, like Parkinson's disease or epilepsy. And in this day and age, there are a lot of surgical treatments that we can actually administer to the patient to help reduce some of those problems. Some patients may have a focus in the brain of an epileptic focus, and despite being on multiple medications, may still not be able to function well. So a certain subset of those patients may be eligible for surgery. We can map the brain, figure out exactly where the seizure is coming from, and then resect it at surgery. Other patients with Parkinson's may have that typical tremor, so they have what's called a pinroll tremor, where they, anytime they try to move or try to do any fine movement, there's a tremor that prevents them from doing their activities of daily living. And sometimes what we can do is place a tiny electrode into a special part of the basal ganglia, which is a deep part of the brain, and then hook that electrode up to a generator, which is generally placed under the skin somewhere in the chest or in the axilla. And when that generator is turned on, there's an electrical current that's passed in that tiny electrode down in the brain, and that actually can stop the tremor. So it's very dramatic when you do something like that in the operating room with the patient awake. And so the patient's awake, you have this tiny electrode that's being passed into the brain, and then as you turn the current on, that tremor just stops. So that's one of the newer techniques that we can do for some functional disorders. Also in vascular disease, in addition to actually operating on the brain in terms of, removing the bone
Alleyne,
and going under the microscope.
Dr. Alleyne,
yeah.
Can you hold that thought on vascular? Let's take a quick break and come
Sure.
back. This camera, for some reason tonight, keeps jumping. And, I want the audience to have a very, good experience here tonight. So let's take a quick break, and hopefully somebody in the chat room will help Jonathan to get on. He's saying that he can't get on. I don't know why, but hopefully somebody would help him.
Okay.
So let's take a quick break.
Take a quick break.
「
So this is better. Vascular. You were telling us.
Yeah, so I was just going to mention some of the newer techniques that we can use now in vascular neurosurgery. So it's someone that has an aneurysm in the head that may have ruptured or may not have ruptured. We found before it bled. The older technique is to make an incision on the scalp, remove the bone, expose the aneurysm, put a tiny little metal clip across the neck of the aneurysm to prevent blood from filling that weakened blister. Well, there's a newer and complementary technique that we use, a more minimally invasive technique, which is basically going through the femoral artery at the top of the hip and passing a catheter all the way up into the neck, and then passing a smaller catheter through that one and carefully putting it into that weakened bubble. And then through the end of that smaller catheter, we pass a small set of coils. So these coils are actually made of platinum metal, but they're so thin that there's the consistency is that of your hair. So they're very thin, very soft, and so they're designed to fill that weakened bubble so that blood no longer flows freely in the aneurysm, and the blood basically just clots off, and that pulsating sac becomes a dead sac of clot and tiny metal coils. And so, by entering the body through literally a pinhole in an artery at the top of the head, at the top of the leg, we can actually treat pretty dangerous problems in the head and minimize the risk of surgery. So we use the open surgery and the vascular technique in a complementary way to help treat certain vascular lesions like aneurysms. We can also use the gamma knife, like I mentioned, that focus beam radiation, which we use to treat tumors. We can also use to treat the tangled mass of blood vessels, because if you give that high dose of radiation to the small tangle in the brain, what happens over time is that the wall of the blood vessel, that abnormal blood vessel wall, starts to get thicker. It gets inflamed, it gets thicker, and over time, usually 2 to 3 years, that tangle will actually shut down because the wall gets thick enough that there's no more flow through the center of the vessel. And so you can actually shut down a dangerous tangled mass of blood vessels with a minimally invasive gamma knife procedure. And the gamma knife is an outpatient procedure. So the patient comes in the morning, they have the frame placed, you do the planning on a computer, and then you administer the dose of radiation, which can take anywhere from 15 minutes to an hour, depending on what you're treating. The frame comes off, and they literally go home. So it's a great advance in the treatment of certain neurological diseases.
So I bet that must have been quite exciting for you.
Yeah, it is.
What kind of medical breakthroughs would you like to see in the future?
So I think that, we still, there's certain diseases that we still don't have a good treatment for. For instance, trauma, head trauma. We still don't have a good handle on some of the cascades that are set up after a trauma. We know a little bit about it, but we don't know how to reverse it or treat it. So we've been working in our lab at Medical College of Georgia Regents University, on the stroke that results after someone has a ruptured blood vessel, a ruptured aneurysm. And in fact, there are a lot of studies that show that curcumin, which is a key ingredient in curry powder, actually helps with stroke. So,
can you repeat that again, Doc?
Yeah. So there's an ingredient in curry powder called curcumin, and again, being from the West Indies, we know a lot about curry. And in fact, there's a lot of anecdotal evidence that certain regions that eat a lot of curry powder have lesser prevalence of certain types of stroke. And there's some newer studies, in fact, there's some NIH trials that show that curcumin not only reduces the risk of certain types of stroke, but can also decrease the risk of Alzheimer, and actually beneficial in certain types of cancer, GI cancer. So 4 years ago, but 6 years ago, my PhD colleague, Dr. Dan DePatney, he and I co-direct the neurovascular lab. But we had the idea of examining curcumin a little more closely. We actually found we're the first lab to show that not only does it work in ischemic stroke, which is a blockage of a blood vessel in the head, but it also decreases the stroke area after a ruptured aneurysm. So when an aneurysm ruptures, blood fills the brain, and that blood sits around there for several weeks. And in the next week or so after the hemorrhage, that blood serves as an irritant, and so it causes the normal blood vessels to actually slowly get narrower. So it's something called vasospasm, where the caliber of the blood vessel is reduced, and that in turn can reduce blood flow to normal brain, causing strokes. So we found that in a mouse model, if you give that ingredient in curry powder to the mice, they were actually having smaller volumes of stroke compared to the mice that didn't get the curry powder. They were just control mice. The problem with the curcumin is that it's not absorbed very well in the gut. So, even if we wanted to give that to a lot of patients to help reduce stroke, you'd have to eat a lot of curry to get the benefit. So we started looking at changing the chemical formula of curcumin to make it more bioabsorbable. Mm-hmm. And so we collaborated with a Chinese company, and it took several years. Probably this is our third year now of kind of collaborating with them. But we finally, and we tested about over 100 compounds. So changing the chemical formula of curcumin, but we narrowed it down to a few, and those few compounds actually are much more absorbed in the gut. So the next step is to patent these compounds and actually try to get it into a clinical trial where we can see if this will have some effect in the patient population that we see with these problems. So, and there are also patients that actually have just a spontaneous bleed in the head, generally from high blood pressure, and those patients also benefit, or we think will benefit from curcumin, because the mice that are given a hemorrhage, they actually have a smaller area of damage, and that hemorrhage actually resolves a lot quicker. So that's just an example of some of the things that we can do in our field to try to effect a change.
That's amazing. Before I go on to the next question, I want to go to the chat room where DSACB said, asked rather, how expensive are these procedures? New techniques? Are any new techniques covered by insurance, or are the new techniques considered experimental?
Good question. So the two techniques that I mentioned, the open surgery and the minimally invasive endovascular approach, they're actually both accepted techniques. Endovascular procedures have been around for a couple decades, but the field is changing very rapidly. So we're getting better coils. We have newer endovascular devices that can actually be placed across an aneurysm without even having to put a coil. So there's something called a pipeline device where we put, it looks like a stent, but it goes into the normal vessel, reducing blood flow to the aneurysm, and that's basically all you need to do. Those are all covered by insurance companies. And to get to that stage, obviously the companies had to do several studies to prove that they were effective, and so that was done. So although some of the procedures can be relatively expensive, those that I mentioned are all covered by insurance.
Okay. And G asked, is there any benefit to taking turmeric supplements that are available in health food stores to help prevent these type of hemorrhage or strokes?
Taking what supplements?
Turmeric supplements.
Very good question. We don't know that for a fact yet. We know in the lab that it works in a mouse. So if you have a mouse with a hemorrhage and you give him turmeric or curcumin, actually, you can actually reduce the damage to the brain. Mm-hmm. We're not sure it works in the human. Anecdotally, we can see populations of patients that take a lot of curry that don't have as high an incidence of stroke. But that's the whole goal of trying to get this to a clinical trial, so we can actually examine a population of patients with the chemical and those without, and compare the two groups. So My suspicion is that we'll probably see a benefit, but there's nothing in the literature to date. But I like curry. I eat curry a lot, so my gut is that it probably will show a benefit. But a word of caution: there've been a lot of studies that work splendidly well in the mouse, but when you try to translate it to the human, they fail miserably. So, just because something works beautifully in the lab in a mouse or a rat doesn't necessarily mean it'll work in the human population.
All
So
right.
that's why you can't automatically assume that it'll be beneficial, but it certainly shows some promise.
You wrote and published several books. Tell us about your experiences as an author, and which of them are you most proud?
Yeah, so as a resident, I've always liked writing, and as a resident, I realized that um, researching on a rare or unusual problem and then writing about it can just help enrich my educational experience and then consequently, other trainees as I got older.
Mhm.
Um, I always try to keep writing, and I try to teach my residents that, if you treat one patient, you've saved one patient. That's one patient you've treated. If you can further the field by writing about a rare disorder or coming up with a new way to do a problem, then you can actually help train generation of trainees after you. So I've tried to get in that mindset. And um, when I was a resident, we were studying for we take an annual exam, a board examinations, which you take for credit or, for real as a fifth year or sixth year or seventh year resident. Neurosurgery is 6 or 7 years. It's all migrating to 7 years. But, we take it for practice very early on. And I had a rude awakening when I took my first neurosurgical exam as a first year resident, where you have knowledge that you haven't gained yet. But it was a good student, and people kind of expected me to do well, and I didn't do well because I didn't study for it. I didn't have the knowledge. But that actually prompted me to make sure that I aced it when I took it for good for credit several years later. And to that end, I started making up questions based on the exam because I realized early on that it's very easy to read passively, even in med school. I mean, I made a conscious effort not to just read a book like a novel. If you do that, you'll probably retain 10 or 15% of the information. What you need to do is after you read something, you put put the book aside and actually try to retrieve the information almost immediately. And it's the act of retrieving information that helps to solidify it in your memory. So if you read and you forget about it, you may never retrieve it. It may completely disappear from memory. So the point is that if you do questions, if you're studying for an exam, you try to do as many questions as possible to force yourself to look at the information from a different angle. So I made up a lot of questions based on the content areas. And so when I was done, one of my mentors, one of the female neurosurgeons at Emory, said, you've got a good selection of questions here. You should probably compile this into a book so others can benefit. So I actually ended up writing a multiple choice book, and it was really the only one. There was one other book that was written in the 70s, and that was mainly anatomy. So it was the first time that anyone had written a multiple choice question book for the neurosurgical boards. And obviously it helped me more than anyone else. But even to this day, people come up to me and say, your book helped me pass the board. So, I think that that just helped reinforce that, if you do a lot of questions in a content area, you'll just remember it better. So that was my first experience of actually writing a textbook, and I was still a trainee at the time. But most recently, I think what I did is I collaborated with one of our medical illustrators at Medical College of Georgia. And let me digress by just saying a little bit about the field of medical illustration. So there's been a rich history between neurosurgery and medical illustration. In fact, the father of neurosurgery, a guy called Harvey Cushing, back in the early 1900s, when he first started doing neurosurgery, and that wasn't really a field. I mean, people used to dabble in it, but people would die. I mean, it was just not people didn't operate on the brain. It was too high a risk. But he very consistently and conscientiously tried to get uh, the um, the morbidity down. So he would record his every complication, and after each procedure, he would actually draw. And he had a very good friendship with the father of medical illustration, who was at Johns Hopkins at the time. But so, neurosurgery and medical illustration, I think, go hand in hand. But the point is that Johns Hopkins was the first medical illustration department to be established, and MCG was the second. So we have the second oldest medical illustration department, and there are not very many of them. There are actually 4 accredited medical illustration programs, not just in the U.S., but in the entire world. So we have one of the 4 in the entire world right at my institution. So I was lucky enough to be able to work with very good medical illustrators. We produce a lot of them every year, and they've populated places like Mayo Clinic and University of Florida, Gainesville. But our medical illustrator that worked in our department at the time was a guy called Mike Jensen. And he had illustrated for the Curious George book series in the past before working in our department. And, and downtimes we used to fantasize about collaborating on a children's book. And, we talked about it for years. And then finally I said, let's just do this. So, and the idea for the children's book actually came up when I was taking my kids and wife down to Florida about 5 or 6 years ago. And they started asking me questions about the brain. And I think I bored them to tears. I started rattling on about the brain and how it works, and they all fell asleep on me. So I was struggling to stay awake myself. And I started making up limericks in my head. I used to love limericks as a kid. And so I started making up limericks on the brain to try to, devise a way to get kids interested in learning about the brain. And so I had to pull over a few times to scribble down verses as I would come up with the verses. And so by the end of the 7-hour trip, I practically had the first book written, which was called Ned's Head. So Mike Jensen then took the limericks and illustrated it very cleverly. And he actually made the character black. So the kid in the book is Afro-American. And I must admit, when I first, I was concentrating on the words and, the medical terms and trying to explain it to a kid. And I wasn't so much thinking about the imagery, but he, conceived this character as a black kid. And I said, that's terrific, because more than any other group, you need minority kids being encouraged to actually go into these kind of fields, neurology, neurosurgery, because there are relatively few role models.
You have a copy of
So he actually came up with clever illustrations to go along with the limericks. And he also hid a tiny hidden head in each illustration with the words MCG also hidden in each illustration for the kids to find. So, we actually published that, we self-published it last year. And I've got a series that have already been written, and other limericks, Bart's Heart, Nellie's Belly, Jones Bones, etc., etc., that we're currently working on illustrating as well.
Dr. Alleyne, do you have a copy with you? What the
yeah, I actually do. Let me see from the shelf here. I don't know if you can see this, but
yes, we can. Wow.
Ned's Head. And I was fortunate enough that this was actually given an honorable mention at one of the recent it's a Royal Dragonfly Book Awards.
Where can we get that?
It's available on Amazon.com. Okay. And in bookstores as well. You'll probably have to pre-order in the bookstore. But it's on Amazon.com.
It never ceases to amaze me how time flies. When I'm on the show, I invite someone on, and I tell them it's an hour and a half, and it's like, you didn't, but some people would question the amount of time, and then once the conversation starts, you run out of time, and there's still lots of questions. And I have quite a few questions I would like to ask you. So
sure.
I'm going to ease down on the brakes. I hope you don't mind.
No problem.
And I want to do some rapid fire questions because there are quite a bit here I would love to dive into.
Okay. I'll try and keep my answers short.
Well, that's all right. This is about you, so answer to the best of your ability. I just want to go to the chat room quickly. The SACCB comment Well, this is a comment. They said, "There's only so much curry one can digest in a month, as you implied. One negative effect is acid reflux." And then Jay asked, "What does success mean to you?"
So the first question was something about curry,
It
but
was a
I didn't hear
comment.
the last part of it.
The first one is a comment. One negative effect is acid reflux.
Ah, yeah.
Yes. And the second question is, what does success mean to you?
So I think success is feeling comfortable with what you've achieved, but not so comfortable that you rest in your laurels.
Hmm.
Um, I think it's important to always set goals for yourself, whatever they might be. I mean, it doesn't have to be. I mean, it's individual. So success is working towards a goal while having your family and loved ones around you. I think there's nothing better than working towards a goal when you've got your spouse or significant other, kids, parents that can help you achieve that goal, and conversely helping them achieve a goal as well. So I think working together to achieve whatever you design for yourself is key. I think the saddest thing is seeing people with tremendous potential who just go through life without goals, and so they never really achieve that potential because they never stress themselves. And it's sometimes uncomfortable to try to achieve a goal and fail, but unless you try for that, you'll never do it. I just remembered I told you earlier that when I was applying to medical school, I did the application for Yale, sat on my desk literally until the last possible week. I mean, I just there was something in me that said, well, what am I doing applying to Yale? Because my impression of Yale was, a place for, American, relatively rich, Caucasian people. So if I'd never even tried, I would never have graduated from there. So you've got to set relatively high goals for yourself. And if you fall short, you'll probably be fine because you've set your goals so high. So I think, that's the key. Always trying to move forward, always trying to grow. Always trying to do things that you haven't done before, just to keep yourself growing.
I'm glad you said that because it gives me a good segue to journey back in time. I have to ask this question.
Now I'm nervous because
When we were children, one of the dreams for boys, and that's a long time ago, one of the dreams for boys is to attend Queen's College, which was the all-boys school. You, like myself, were one of the first sets of boys to attend Bishops.
That's right.
Migrating from Queen's College and you going in for the first time. That was the first year of co-ed. How did that affect you when you were told you were going to Bishops and not Queen's College?
Well, for me, it probably didn't make a huge. I think if I had been to Queen's College and then transferred to Bishops,
right,
it might have been a little more traumatizing. but it really didn't affect me at all because that was all I knew. So I went from a primary school, St. Gabriel's.
Right.
I mean, that was co-ed. Girls and boys in the same class. So to transition to a secondary school with boys and girls was not really a change in mindset for me. Good. So it didn't really affect me, I think, as much as it probably affected some others. And I was the second year, so the first year was the experiment. I started in 76. I think 75 was the first year.
75, that was the first year.
And I started in 76. So, and my mom was a teacher there. So I kind of knew Bishops because much better than QC, obviously, because I didn't have any family member there. So,
but let me ask you this question. Let me interrupt you.
Yeah.
Your mother, one of our great teachers and mentors, taught so many of us at Bishops. How did it affect you as a student? Let it rip.
I think, again, subtly, when you have your mom as your teacher, as a teacher at the school, it can affect you in subtle ways. Now, thankfully, they had an unwritten rule at Bishops that your mom never taught you, which I think was a very good rule. So we were never in a position where you had your mom actually directly teaching you, but you always felt that you couldn't really do things that you might want to do because the other teachers always kind of expected a standard of you as your mom was a teacher, and
right.
and so I was thankful that when she became head teacher, I had already gone.
Many of us.
But I think, the short answer, I think it affected me positively because it helped. It kind of, made me want to do well in school and study and again, participate in sports. Remember one of my fondest memories is sports day, competing. I just remember the healthy competition between the, Vivas and basket and whirl and, all the houses. And let me just digress for a minute. I know you you weren't in Jamaica for the reunion
Thanks.
a couple of years ago, but the funniest thing was seeing those old rivalries rekindled in every age group. So, it was just the funniest thing seeing the 50-yard dash on the beach or, sack race, and then seeing our progeny, our kids actually getting caught up in the spirit as well.
Yes.
So that's something that I think the American schools can learn from a lot, is that British system, because I think, people feel part of a subgroup within a school. You never get lost within a big secondary school. And then you're competitive. You're internally competitive with your classmates in a different house. It helps you to compete in sports and elocution, all those good things.
Well, you're going to have another opportunity next year because we are planning our 2040 reunion, which is going to be in New York.
That's right. Yeah, I'm not sure I'll be able to make New York, but
well, I hope you can, Dr. Alleyne.
Yeah.
Which brings me to my next question. We attended school at a time when education was fine-tuned. Some of the most brilliant and committed minds nurtured and taught us. They instilled in us a sense of pride and respect as they prepared us for excellence. What in that period is indelibly etched in your mind?
Say the last question. What about...
What in that period is indelibly etched in your mind?
I think, there are several things. I mean, the school motto, is just a bunch of words. But, behind those words, I think, is a true sentiment that I think a lot of us graduating from bishops and from actually most of the high schools in Guyana that day bear in mind. Work conquers all. And I think you'll find that a lot of immigrants, particularly West Indians, will come up to the States and just work their butts off. I mean, you've got a limited lifespan, you've got resources, and you want to take advantage of your abilities and your training. And I think, the sentiment that you work hard, take pride in your work. I think those are two key messages that I and several others took away from the high school training.
I'm going to ask you for a little technical help. I think you're closer to your monitor. Can you push right? Or push your screen out a little.
Getting too animated, huh?
Yeah. No. Doc.
Okay.
You almost made me commit myself there. Why is it so important to encourage kids to reach beyond the stars?
Again, it's because if you don't do that, they'll never achieve their full potential. Some might just by luck, but I think kids at that very early age will never know what's possible for them. And I think it's exciting for me when I go, and I don't do this a lot because I'm very busy, but when I go to a school, and I've done that maybe 4 times in the last year, I take a skull, plastic skull, a model, or I take a cadaver brain, I take my book, and I just tell them about the brain. I can just see their eyes light up. It's like, some of them may have never thought to think, well, what's going on inside my head? What's going on in the brain? How can I talk or think? And I think that the more we do that, not just for neurosciences, but for every specialty, the more we can encourage kids to aspire to something greater than what they're seeing every day. I mean, obviously they're seeing some things that are not so nice around, depending on the communities they come from, but even on television, they may not see the variety of role models that they should see. And so sometimes you just gotta, you know, to show them that's possible at an early age. If they grow up not seeing someone of color or someone like them in that position, I think sometimes they just have this mindset that that's not achievable.
Hmm. And mentioning that era in which we were raised, what, in your opinion, can educators borrow from that era to cultivate much more well-rounded students?
I think. So repeat the question one more time,
What
Selwyn.
what what, in your opinion, can educators borrow from that era to cultivate much more well-rounded students?
Yeah. So yeah, I think that back home, I'm always, when I'm asked, I always tell people that I firmly believe that our educational system back home prepares you more fully for life compared to some other systems. So, we tend to broadly specialize early, but then we go into depth early on into a specific field. So, for instance, at the O levels or even before O levels, we take Spanish, we take French, science, economics, whatnot. But then we don't just dabble in everything. You start to really kind of focus down on a particular arena or area. And so I think that rather than superficially covering areas or having this mindset that everyone's going to get an A. I mean, you just promote people or pass people despite the fact that they may not get the material. I think that's dangerous.
Yeah.
And I think teachers are so important. I'll tell you another quick anecdote. When I was I forget which form, but we were starting chemistry, probably first or second form. And the first time I was introduced to moles and Avogadro's principle and all these chemical terms, I had no idea what was going on. It was like, I didn't know what the teacher was talking about, and it was hard for me to grasp the concepts. Thankfully for me, within the first week or two, that particular teacher got ill, and a substitute teacher came in just for a couple times.
Hmm.
And in one fell swoop, that teacher was able to explain things in a way that it was like a light bulb going off. And looking back, that was just lucky for me. If I didn't have that particular teacher explain things a little differently, I would have never done chemistry. I would have probably just kind of signed off and said, well, this is something I don't get. But there was such a stark difference between the two teaching styles that always stuck with me, and it's an important lesson. I think that teachers are very, very critical, and also important lesson to kids. If they're not quite getting something, and it's not always them, just look at another way of learning it. Get some help, get someone else to teach you, and just changing the focus or just coming at it from a different angle might make the difference in just making that light bulb go off. And once that light bulb goes off, it's just downhill from there.
So, let me go to the chat room. The SACB said he went to Gabriel's. You have a cheerleader here. You went to St. Gabriel's.
Who's that?
DSACCB. I don't know who the person actually is, but that's
Okay.
just their code name. Jay asked, and after Jay's question, we're gonna do some rapid fire question and answer, so
Sure.
I can get in as many of these questions I have. In setting a goal, this is Jay's question.
Yeah.
Which do you think you should follow, your passion or your talent or skills?
That's a very good question. I think it's gotta be a combination of both, because it doesn't do any good to set goals that you're very, very passionate about, but there's really no realistic way of achieving it. So, for instance, I could say I want to be a world-class pianist, or I want to be an astronaut. Well, at this late stage, that's never going to happen. I mean, there's a theory you've got to put in a certain number of hours to get to proficiency.
Right.
So I think that you know the earlier you can identify a passion, the better for you, because then you've got the time to build up those hours to actually get the proficiency in it. So if you can identify the passion and talent early, then you're ahead of the game. Later on, you may have a passion, but it's harder to, unless you have an innate talent for it, it's harder to get to that point where you can make that passion your career or your livelihood. So, but it's got to be a combination, because if you just set goals that you think are reachable, but there's no passion in it, you're not going to be happy. And so I think the trick is to come up with a goal that is something that you've always wanted to do, that you think would be neat, but you can outline clear steps to get there. So it may be currently unattainable, but if you can say, well, in order to do this, I've got to do this. In order to get to A, I've got to do B. In order to get to do C, and you may have a long string of alphabet numbers, but if you start from Z and you work yourself up, you'll get there. Yes. And that's part of the fun, is just kind of working towards that goal.
I read somewhere where you tell your students, if you're going to do whatever you do, you're gonna work hard at it, or it's going to be challenging or something. So you might as well work hard at something that you love. I'm not sure if I am misquoting you here, but that is the gist of it.
That's very true. Because, for instance, when I was thinking about neurosurgery, I mean, a lot of people were like, well, why would you go into a field that takes 7 years? I mean, you're in debt by the time you're done. Do something that you can get done faster. And I guess my point was that, if it's something that you really like, I mean, and usually it's like a gut feeling that this is for me, why not do it? Because the saddest thing is to see someone that really wanted to do something, but for whatever reason never did it. And then later in life, they're just filled with regret.
Right.
So, yeah, I mean, you're going to work hard at something. And there are a lot of people that work very hard at jobs that they're really not passionate about. I mean, some 2 or 3 jobs just to make ends meet, and really, you can't do it for money, because if the passion's not in it, then you're not really enjoying the process. And I think life is so short. You've got to make the most of it and enjoy the journey. So it's not always just attaining the goal, but it's the act of working towards that goal that can be very very fulfilling.
Well said. Now comes the rapid fire.
Now I'm scared.
Before I go into that, this is a question that's been haunting me for a while. What is the most fascinating thing that you've discovered in the brain, or about the brain, that most of us will never even think about or know?
Oh, that's a good question. It's got to be the ability of the brain to recover, because we're always taught that you're born with the amount of neurons from birth, and from the time you start growing, things kind of the connections start dissolving. You start losing the neurons by the time you're middle age. Some people Alzheimer's starts setting in. So we're always told that you've got that complement of neurons or brain cells, and I'm always amazed that patients that have pretty devastating strokes will get better. They'll improve. And sometimes you can actually see plasticity at work. It's much more common in a kid. So, for instance, you can actually do a procedure in a kid where you remove almost half the brain. It's called a hemispherectomy or hemispherotomy for diseases like seizures or a particular type of inflammation. And that kid will have complete paralysis on one side, but then within a year or so, they'll be able to move it, because other parts of the brain take up the functions of the diseased brain. And you see that in stroke as well. And I think that if we can somehow find out more about that and harness it, that's when we're going to make a big advance in medicine. Because even people that have, strokes or spinal cord injury, for instance, if we can figure out how to, stimulate the stem cells, those cells that have the potential to grow into other cells after an injury, then I think you'll start seeing a lot of big advances in stroke and and medicine in general.
Thank you for that answer. In your opinion and experience, what makes a good physician?
A good physician is someone who can always empathize with the patient. So I always try to teach my residents, and I tell my patients this too. Always pretend that the patient you're seeing is a family member or could be one of your own family members. And if you do that, you can never go wrong. I think, to some extent, we've got to distance ourselves to some extent from a patient from time to time. And we've also got to, um, when we have a task in mind, and sometimes we do very difficult surgeries, you've got to be so focused that you kind of screen out the emotional stuff. So you're just getting the task done. But before the surgery and after the surgery, you've got to be very empathetic, because that way you'll always treat the patient better, and you always have one standard for every patient. There's some patients that you may not relate to in terms of coming from a completely different background. But if you remember that that patient has, a loved one, a mother, a father, a son, then I think you'll end up always doing the right thing for the patient.
In that answer, is it fair to assume that this question here, what would you say distinguishes your approach to medicine, has been answered?
Yeah, I
Okay.
think treating patients like their own family member, and also I think realizing that we still haven't, we don't have all the answers.
Hmm.
And so I think by being in academic medicine, it gives me a chance to kind of find new ways or discover new treatment modalities to try to improve the specialty as a whole. So I think those two things, and sometimes it's hard to do. Sometimes you just kind of get in a rut of doing the same procedure over and over. But I always kind of challenge myself to try to come up with, a different way, or try to figure out, well, there's got to be a better way to do this. This is the way we've always done it, but it doesn't mean that there's not a better way. And I think if you have that mindset, if you don't have that mindset, I think you miss a lot of opportunity for improvement.
So well, I almost asked you a silly question. So you're focused. I mean, that much is very obvious. Who in your field, alive or deceased, do you admire and why?
In my field, so I think probably the person who's deceased is the father of neurosurgery, Harvey Cushing. I when I was a resident, I read his biography, and it was pretty incredible. Here was a guy who he was not the nicest of personalities, but he had this goal. He was driven to make neurosurgery better, and it was not it was not a field when he started out. And so, against all odds, he basically improved the specialty and basically started the field. And in fact, the story is such an incredible one that when I read it, I said, this reads just like a movie. I mean, this whole progression of the field of neurosurgery against the backdrop of the First World War.
Before you go into there, before you
Yeah,
go there, I have a series of those questions to ask you
yeah.
about that
Okay,
that
I'll hold
journey
on.
you took. So hold on a second, Dr. Alleyne.
Okay,
Let me ask you these first because we want to do rapid fire, and then I want to
sure.
get into that, right?
Yeah.
As a renowned and skilled surgeon, what intrigues you about your field? Is that a fair rapid fire question?
I'm
Or
sorry, repeat the question.
as a renowned and skilled surgeon, what intrigues you about your field?
Um, the ability to treat patients that have a lot of terrible diseases. So, the ability to see to make a difference in patients that have pretty significant diseases. And also, I think the it's not just a rote field. You're not just working with your hands. You're also thinking through problems. You're also coming up with the best approach to treat the patient. So, I think the combination of using the mind and the hands is what endears me to the specialty.
Have you have you during surgery? And I don't know if this is a fair question, but have you during the surgery had a aha moment?
I didn't hear you.
Have you ever had an aha moment during surgery or during a procedure?
Um, yeah, yeah. I mean, it depends on what you define as an aha moment, but there are a few times where you're operating, you have a certain plan to get a procedure done, and you realize that things aren't quite working out the way you planned. So you've got to be able to think on your feet
Mm-hmm.
and kind of come up with a different scenario, a different, you know, a different war plan while you're actually attacking the problem. And I think that's the other thing that appeals to me. So, um, you know, you can be working on a very bad problem, an aneurysm, say, that has ruptured, and you know the aneurysm can rupture in your face. So you've got bleeding coming from this blister. You've got to be able to come up with a plan to get it fixed. So, you know, I think thinking on your feet, modifying the plan,
Mm-hmm.
that happens a fair amount in surgery. Not all surgery. Some surgeries are pretty routine. In fact, you know, if you're having too many aha moments, that's probably bad. So,
What do you enjoy most about your job?
I'm sorry.
What do you enjoy most about your job?
I enjoy the patient interaction, but
Mm-hmm.
I also enjoy teaching residents. I'm the residency program director where I'm at. So I actually, you know, teach residents over the 7-year period to become neurosurgeons.
Okay.
And so it's very gratifying to see someone that comes in wet behind the ears, not knowing a thing about the practice of neurosurgery. I'm just watching them mature and evolve to become an independent practitioner at the end of that 7-year period.
And if you had to do it again, will you choose neurosurgery?
Definitely.
Definitely.
I think most people that do neurosurgery, they'll tell you that they couldn't see themselves doing anything else.
Ah.
I actually, that probably is not exactly true for me because I actually did enjoy almost every other specialty. I mean, I could see myself doing it, but when I did the neurosurgery rotation, you know, again, it was like, you know, just seeing the live brain there being operated on, it was like, this is it. I mean, there's nothing that can beat this. And that combined with my love for anatomy and the neurosciences, I think just sealed it for me.
Now, I almost always remember this guy that went to school with us. I know time is at hand, but I remember Trevor Duncan. You
Uh-huh.
remember him?
I remember him. Yeah, I remember the name. I
Okay.
remember him too.
Yes,
Yep.
he's a doctor,
Ah, okay.
and many years ago, I think in the 80s or 90s, he had just returned from Cuba. I love to tell the story whenever I meet another student from bishops that are doctors because there are so many.
Yeah,
Yourself and Jennifer Bastio and Yvonne Atlee and Sharon Griffith and
that's right. They're all
lots of people
over.
who are functioning at a very high level. There's Terence Campbell, not a doctor, but he's a businessman, land science. People are functioning at very high levels.
Yeah.
Jonathan Locke and so on and so forth. And I remember the story, and I was talk very fast because I want to get it in. I went back to Guyana on a visit, went up into the interior, I think Barima or Maruma or one of those places, met Trevor, and I was very excited. Said, oh my gosh, you're a doctor, you studied in Cuba, you came back, and I'm carrying on. He said, Selwyn, come, sit down. And he said to me, he said, I am no better than anybody else. I am not that special. I said, well, what do you mean? You're a doctor. He said, no, Selwyn. What else were we supposed to become? That is what they trained us. That's how they groomed us
Right.
to be excellent. And that level of humility stuck with me. And
Yep.
something I know, there's a common thread among all almost all of us, or all the people who have gone to bishops and are excelling, whether it's Vibert Yaw, Sister Benita, yourself, and so on. There's this humility. What do you think is responsible for that?
Well, I think again, you know, we were taught early on that we can achieve anything, but as we matured, I think we realized how special that grooming and installation was to us. I mean, every time I see a kid that ends up on the wrong side of the street or in jail, I just it gives me some despair because I realize that a lot of it was just that kid's circumstance. I mean, I went to teach to give a brief talk at the jail about 3 years ago, and these were juvenile prisoners. I mean, these were people that had committed arson and murder and really bad things, but these were kids. They were really kids, and it was really sad because you realize that in their life, no one had really guided them as we had guidance,
Hmm.
and they were bright minds in there. And it's just striking that I think that, you know, sometimes your circumstances is you have no control over the environment you're actually brought up in.
True.
And I think that brings some measure of humility because we could have turned out completely different if we were in a different situation, you know. So I think that that also I think helps me to realize that you know, as much as possible, I need to try to encourage, you know, the younger kids that they can do anything. Just by trying to set an example and letting them know that there are other things out there.
Thank you. And tell us about your decision and what inspired you to write the screenplay, Hands of Gold, Feet of Clay, the Harvey Cushing story.
So again, when I read the biography of Harvey Cushing, I was just very struck by his ability to set goals. I mean, he was so goal-oriented that he single-handedly launched his specialty in neurosurgery and brought the complication rate down. Despite the fact that his own mentor, a guy called Halstead at Hopkins, was telling him, you know, why do neurosurgery? Do orthopedics. That's where the money is. His every complication was plastered over the newspapers because this was something that wasn't being done at the time. So, you know, these newspaper reporters back in the day would say, you know, Harvey Cushing is at it again, you know, killing patients. And he would just doggedly keep at that goal. So I remember, I think it was George Lucas that said the best stories told were one man's struggle against insurmountable odds. And it's true. If you look at every good story, all the great screenplays or noble winners, it's always one man struggling against adversity. You know, be it you know, the pianist or Gandhi or Patton or whatever. Usually they have quirky characters. So and Cushing was not necessarily the most pleasant person to work with. he was paranoid about getting things right that he would very frequently lose his temper with people. So, you know, it just struck me as a great story that if more people knew about it, they may actually be inclined to look at neurosurgery. So I always loved movies. You know, growing up in Guyana, we didn't have television until I was a teenager. So, you know, going to the movies or coming to the States, we were glued to the TV set. And I just loved the ability to kind of, you know, translate the written word into a motion picture. Mm-hmm. So I kind of taught myself everything I could about screenwriting, and wrote the screenplay, and was lucky enough that it was, I think, 13th out of 1,500 entries in some screenplay competition. There are a lot of them around. But I've been kind of hoping to get it onto the big screen. Not so far. You know, there's no explosions or car chases, so it's a little harder. But I think it's just a great story, and just shows how that despite an almost insurmountable goal, he was able to throughout his lifetime get to that stage. And I was inspired because in our dorm at Yale, in the basement of the dorm, was housed some of the brain tumor specimens that he actually had operated on almost a century before. So these brains with, you know, fungating masses were sitting in these big glass jars filled with formalin in our dorm basement. And it was just an incredible sight to see that this one guy had operated on 1,000 brain tumors in his lifetime, which is not a lot by our standards, but back then that was you know, tremendous.
And this received 13th place at the Filmmakers International Screenwriting Awards. Was that your first time writing a screenplay?
I'm sorry?
Was that your first time writing a screenplay?
Yeah, it was actually. Again, I was just challenging myself. Something I had never done. I had no clue about writing screenplays, but you know, I just bought a stack of books. It took about a year actually,
1 year,
learning about screenwriting and also reading everything I could about Harvey Cushing. So it's funny. I almost feel like I know the guy, even though, you know, he went to Yale exactly 100 years before I did.
So there are some parallels there then.
I'm sorry?
There are some parallels there then.
Yeah, and it's also weird. One of his siblings' name was Alan Cushing, spelled Alleyne. So just a weird weird coincidence.
Besides screenwriting, what are you passionate about and why?
Well, I like going to the movies with my wife. We love spending time together. Bike riding, like working out in the gym. watching my kids do their respective sports. My son's a black belt in Taekwondo and a big swimmer. My daughter's a cheerleader and a budding runner. She almost made it to the Junior Olympics,
Oh,
missed
really?
it by a fraction of a second, despite just a couple of months of doing track and field. So it's exciting seeing them grow and evolve with their own interests. But yeah, those are some of my passions. Spending time with my parents. We just came back from Barbados. Their 50th anniversary is going to be this December, and so it's nice to spend time with the whole family, wife, kids. And,
Congratulations to them, and
Yeah.
please extend my highest regards to your mom.
I certainly will.
What are you most proud of?
Most proud of my family,
Family.
definitely. Again, just seeing these little organisms kind of grow. So, you're a father yourself, and
Yes.
and that's when you really appreciate how your parents feel about you, because you have no clue until you have a kid of your
Oh,
own.
yes.
so, I'm proud of my wife and kids, and they're entering the teenage years. My son's actually going to be 14. My daughter's going to be 12 this coming Saturday. So
Happy birthday to her too.
yeah,
Is this your dream profession?
neurosurgery. Yeah,
Yes. Okay.
yeah. And again, it wasn't a dream that I was born with or even had in college. I thought I was going to be a chemical engineer,
Uh-huh.
but once I knew I was going to do medicine, during my second to third year is when that dream evolved about doing neurosurgery. And again, there were some hurdles. I mean, neurosurgery was thought of as a very difficult field to get into. Not a lot of minorities in there, but set a goal for yourself and work hard. Another quick anecdote: in medical school, there were two of us going into neurosurgery, and the other guy, everyone thought was just brilliant. I mean, he just knew everything before the teacher even taught it. And so one day I said, well, what's your secret? And he said, very simple. The summer before medical school, he bought all the books. He read them cover to cover. So when he was seeing it in the first semester, it was not for the first time. For everyone else, it was the first time they were reading it. This was his review. So during that period, he was reading ahead to the next semester. So, that was kind of a lesson, that you always be prepared.
Be prepared.
Always try to do your very best. And even now I tell the residents, if you're a fourth year medical student, pretend that you're an intern, the next step. So act as an intern. That way you'll always do your best. When you're an intern, pretend you're a junior resident. When you're a junior resident, pretend you're a mid-level. When you're mid-level, pretend you're the chief resident. When you're a chief resident, imagine you're an attending, because the very next year, you're going to be out there managing your own patients. So you have to psychologically get yourself into the frame mind of being one step above or one step ahead, and that way you'll always do your very best.
Sound advice. What is it about your work that feeds your spirit?
What is it about my work
That feeds your spirit?
Again, just seeing a patient come back to clinic and just thank you for doing a job.
Uh-huh.
And sometimes it's not necessarily that the patient is completely cured, because there are some things that we can't cure. But I think that if you empathize with them and they'll sense that you're doing the very best for them, they'll always be thankful.
Okay.
I can't tell you how many patients that I see back in clinic, maybe paralyzed from a ruptured aneurysm. So they come to you already paralyzed. You can't undo the paralysis, but you can treat the aneurysm, prevent it from bleeding again and killing them, and they'll come back with just very grateful. And I think that's what keeps you going. On the dark days when you have complications or you have patients that you can't do anything for, just going to clinic and seeing a patient that you'd operated on 3 months ago when they were half dead, and then having them come out, actually walk to the clinic and thank you. I mean, that's just the greatest feeling.
Wow. DSACCB said, really, as a child at St. Gabriel's, we saw his curiosity and focus. We expected him to pursue a profession in the medical field, science, or technology. They had eyes on you since then. What do you do on your days off?
So,
I think you answered that before with the biking and so on. But go on, give it a shot.
yeah. So I had a sage advice from an old neurosurgeon when I was in Rochester in practice early on. He said, remember to have date night. And what he meant by that is always set aside time to spend time with your wife. So Friday nights is our date night. We usually go dinner on a movie. We don't do it every Friday because either she's on call or I'm on call. But on the nights when we're both not on call and the kids don't have activities, we just go see a movie or go dancing. We did ballroom dancing a few years ago for about 3 months. That was a lot of fun. And when the kids were very young, and my parents came down to Evans, which is not too far from us, 20 minutes away, we would actually take them to my parents because I realized that when they were up in D.C., that my kids were growing and my parents were getting older, and they weren't getting a chance to interact very much. So we brought them down about 6 years ago, and so we would take the kids to my parents, and we would go, see a movie, go dancing. We both like partying back from from the old days. We don't do it very often now. In fact, like once a year when we go to a club, we should do this more often. But if we did it more often, we'd probably be laid up because we get old.
What is next for you?
I'm sorry?
What is next for you?
What is next? Well, I think, we and the faculty at MCG, we've built up a good training program for the residents. I'm happy with my career. I'm just trying to kind of keep learning and evolving. Hopefully get some research breakthroughs or at least some studies done that might help patients. And just to kind of just enjoy, the rest of life. Just try to keep making goals and trying to achieve them, and just see where life takes me.
What will you be in or should I say, where will you be in 5 years from now?
So, in academic medicine, you can never really be sure that you're not going to be recruited somewhere else. But we've now been in Augusta for 10 years. Actually, it's almost exactly 10 years. This is home to my kids now. They came when they were 1 and 3. My parents are here. My wife's parents are just an hour or 2 hours away. So I see myself kind of watching our kids grow, make it through the teenage years, getting them off to college, and just continuing to do what I do.
Well, last but not least, a question I ask all my guests. What makes you laugh out loud?
That's a good question. I don't know. Seeing my wife or kids do silly things, see them enjoy themselves.
Right.
That makes me laugh out loud. I'm sure if I think harder, I can think of a few other things. But,
I see you're thinking about a few things right now.
Yeah.
Well, Dr. Alleyne, thank you once again. Thank
you. You're very welcome, Selman.
Yeah, thank you so much. Can you take us out with a few words of advice? I know you've given us many pearls, but give us another pearl just for the youth.
Yeah, so for the youth, again, I think reach for the stars. Don't believe all your mentors, because some of them will not, they'll be quoting generalities and not really recognize your potential. So just believe in yourself. Use failure as a way to incentivize yourself. So, you may not always achieve the thing you wanted to do first time around, but that should just rekindle the fire in you even more. And never forget the family and friends that helped you get where you are, because no one does what they do by themselves, and so I think that's key. You can, I feel like I never repay my parents for what they, what they've instilled in my sister and I, and all the support that they've given us, but we try, and then you try to pass it on to someone else, to your kids or family friends or other youth. So to keep that cycle going.
And
So that's it.
thank you. And before I go, Jay in the chat room said, very inspiring. Thanks, Cargill, for sharing, and Selwyn, thanks again for facilitating this wonderful show. Thank you, Jay. And Cargill, again, thank
Thanks,
you.
Owen. Thank you very much.
Right, and I really appreciate you coming, and I hope Jonathan finally got on. I forgot to mention to him that you cannot get this show on your iPad, so.
And best of luck with your show too. I'll see if I can get a few people that might be worthy interviews and people with inspiring stories or different journeys as well.
Oh, thank you.
I know a couple, so.
I appreciate that, and speak to your sister as well. I'll be happy to have her on the show and have a conversation with her.
She may be a little shy, but I'll tell her.
Tell her. Well, thank you. Thank you so much.
You're very welcome.
And this is Selwyn Collins saying good night, and please tune in tomorrow same time for a conversation with Mutsa Mangezi, born in Zimbabwe and resident of South Africa. So good night.
Good night to all. Bye.
Bye-bye.
Suffer the little children to come unto me. Every day, more than 30,000 children around the world die of preventable diseases. More than 300,000 children are being used in war as child soldiers. Lord have mercy. A child should be loved. A child should be held. A child should be clean. A child shouldn't smell. A child shouldn't go to bed hungry at night. A child should be taught wrong from right. A child should learn to say thanks and please. A child shouldn't suffer from preventable disease. A child is a fruit that shouldn't be picked before it's time. To do that to a child should be classified a crime. Oh, who speaks for the children?